In this session, we'll be dealing with medulla oblongata, so which is the part of the brainstem. We'll see the external features and three different transverse sections. So we'll keep it simple. We'll deal with extreme basics. We'll not go into the complicated applied aspects and all. We'll just keep it simple, like what is the external features, what will be the gray matter, what will be the white matter, and basic function of this gray matter and white matter. What will happen if this gray matter and white matter at different levels is subjected to either ischemia or infarction. Okay, so let us deal with the external features. And medulla oblongata, so it is a direct upward continuation of the spinal cord. It is the lowest part of the brainstem. It is also called as bulb. So length is approximately 3 centimeters, breadth is 2 centimeters, thickness 1.25 centimeters. So it hosts vital centers like respiratory and vasomotor. So last 4 cranial nerves emerge from it. Lower part of medulla is like spinal cord, contains central canal. Upper part of medulla is open, and this central canal widens to form lower part of the floor of fourth ventricle. Medulla connected to the cerebellum through inferior cerebellar peduncle. So you can see here, this is the ventral view of the brainstem. So if you observe here, these are the pyramidal decussations. This is the pyramid, and you can see this is the olive. Between the pyramid and olive, you can see the rootlets of the hypoglossal nerve. So behind the olive, you can see the glossopharyngeal nerve, the vagus nerve, and the cranial root of the axis nerve coming and joining with the spinal root of the accessory nerve to form the accessory cranial nerve. So here also you can observe, this is the abducent nerve, this is the facial nerve, the motor root, and this is the nervus intermedius, and you can see the vestibulocochlear nerve. So these are all the views on the ventral aspect of the brainstem. Most important structures here also you can see, this is the trigeminal nerve at the junction of pons with the middle cerebellar peduncle. Here you can see the oculomotor and trochlear nerve on either side of the cerebral peduncle. Here you can see this is the tuber cinereum. You can see the mammillary bodies. This region will be the infundibulum. So this is the optic chiasma. This particular area will be the interpeduncular cistern. Now you can see on the ventral surface what will be the features. The ventral median fissure, continuation of the ventral median fissure of the spinal cord, that is the anteromedian fissure. So divides the medulla into two halves. Its lower part is masked by decussation of most of the pyramidal fibers. You can see here the lower part is marked by pyramidal decussation. An elevation lies on either side of the ventral median fissure produced by corticospinal tract. So this is the ventral median fissure. On either side you can see the pyramids. So next olive, an elevation lies lateral to the pyramid produced by inferior olivary nucleus. See, this is the olive on the lateral aspect of the pyramid. So hypoglossal nerve emerges from sulcus between pyramid and olive as I shown in the earlier diagram. You can see the hypoglossal nerve here emerging between pyramid and olive, and remaining 9, 10, 11 cranial nerves emerging behind the olives. So you can see here the 9th, 10th, 11th cranial nerves coming behind the olive, the 12th cranial nerve coming in front of the olive. Dorsal view, you can observe mainly this is the floor of the fourth ventricle. The upper half will be found by the pons, the lower half will be found by the medulla, and you can see the dorsal view of the lower closed part of the medulla. You can observe here, this will be the gracile tubercle which overlies the nucleus gracilis. You can see the cuneate tubercle which overlies the nucleus cuneatus. You can see here this will be the fasciculus gracilis and fasciculus cuneatus reaching the gracile and cuneate tubercles. You can see here this is the obex, this is the funiculus supperans, and this will be the inferior fovea. This will be the hypoglossal triangle. This will be the, in this area you can observe this is the vagal triangle, and here you can see the stria medullaris. Here you can see this is the entire median sulcus. This will be the sulcus limitans. Here you can see the facial colliculus. This will be the superior fovea. This will be the locus ceruleus. You can see here this will be the middle cerebellar peduncle. This will be the inferior cerebellar peduncle. This will be the superior cerebellar peduncle. So all these features. So we have two different parts here. One is the closed part of medulla. The other one is the open part of the medulla. So we are going to discuss the dorsal view in both these halves. So if you see the closed part of medulla, the cavity is the central canal. There will be dorsal median sulcus dividing the closed medulla into two halves. So this will be the dorsal median sulcus, posterior median sulcus to two halves. And you can see fasciculus gracilis on either side of the dorsal median sulcus and gracile tubercle. So these two are the fasciculus gracilis and these are the gracile tubercles, and this will be the fasciculus cuneatus and this will be the cuneate tubercles. And here you can see the tuber cynarium. So cuneate tubercle and elevation produced at the upper part of the fasciculus cuneatus. So this marks the site of the cuneate nucleus. So in the upper part of medulla, so this is the lower half of the cavity of the fourth ventricle. So on either side, there is an inverted V-shaped sulcus, divides the area into three parts from medial to lateral side. That is the hypoglossal triangle. You can see here. So this will be the hypoglossal triangle, this will be the vagal triangle, and this will be the vestibular area. Overlies hypoglossal nucleus, vagal triangle overlies the dorsal vagal nucleus, vestibular area overlies the vestibular nuclei. So internal features, so studied at three important levels. One will be the pyramidal decussation, that is the motor decussation, sensory decussation, and then the inferior olivary nucleus. So let us see corticospinal tracts from cerebral cortex to the spinal cord when they are descending. So they are going to form a rounded elevation here. That is the pyramidal tract, which underlies the pyramid in the medulla, so which I have already shown you there. So this corticospinal tracts, they decussate in the midline and cross to the opposite side and reach the lateral aspect and descend in the lateral aspect as the lateral corticospinal tract, and the undescended fibers will descend as anterior corticospinal tract. So we are going to take a transverse section of the medulla at the level of pyramidal decussation, and we are going to see what is the gray matter present there, what is the white matter present there, what is the important function. So let us see here. You observe. So as you see here, this entire area is the gray matter. Okay, and this lateral part will be the white matter. So if you observe this gray matter, you can see there is nucleus gracilis, you can see nucleus cuneatus, and you can see the spinal nucleus of trigeminal nerve. So you can see this is spinal tract overlying the spinal nucleus of trigeminal nerve. You can see the corticospinal tracts, they are decussating and going to the lateral aspect when they are descending as lateral corticospinal tract. And here when they are decussating, they are separating this anterior part of the gray matter. So this detached anterior horn will form various important nuclei. I'll show you in the next slide. So then you can see this is the reticular formation, this is the lateral spinothalamic tract, these are the dorsal and ventral spinocerebellar tracts. So now if you see the gray matter, we are seeing the nucleus gracilis, nucleus cuneatus, spinal nucleus of trigeminal nerve. And white matter, if you see, this is the fasciculus gracilis, fasciculus cuneatus. You can see here the spinal tract, you can see spinocerebellar and lateral spinothalamic tract. And you can see the detached anterior horn of the gray matter. So what it will form is nucleus gracilis, nucleus cuneatus, nucleus of spinal tract of trigeminal nerve. This detached anterior horn forms the nucleus of accessory nerve and supraspinal nucleus of the first cervical nerve. Nucleus of accessory nerve and supraspinal nucleus of the first cervical nerve. So detached anterior horn from the central gray matter due to pyramidal decussation is forming in the nucleus of accessory nerve and the supraspinal nucleus of the first cervical nerve. So what will be the white matter? The spinal tract of the trigeminal nerve, which I have already shown in the figure. You can see here, this is the spinal tract of the trigeminal nerve. Then pyramidal decussation. You can see here, this is the pyramidal decussation. So 75% of the fibers cross midline and reach opposite lateral white column and run as lateral corticospinal tract. Diffuse zone of fibers and nerve cells in lateral white column called as reticular formation. You can see here. So this is the reticular formation. So in the white matter, these are also the additional tracts which I have shown there: posterior spinocerebellar, antispinocerebellar, and lateral spinothalamic. In addition to it, so many tracts will be there, but their contribution is very less in the white matter here. So prominently we are seeing lateral spinothalamic, dorsal and ventral spinocerebellar tracts. You can see here, this is the pyramidal decussation. Now coming to the second transverse section, that is the sensory decussation. Again same story, gray matter and white matter. So if you observe here the gray matter, you can see the nucleus gracilis, you can see the nucleus cuneatus, you can see the accessory cuneate nucleus, you can see the spinal nucleus of trigeminal nerve, and in the central gray matter you can see the hypoglossal nucleus, dorsal nucleus of vagus, and nucleus tractus solitarius. Okay, so then you can see here, this is the tectospinal tract which is coming here, or the medial longitudinal bundle. So this will be the medial lemniscus. So this is the beginning of medial lemniscus. Like if you see the second order neurons from this dorsal column pathway, the first order neurons have relayed in the nucleus gracilis and nucleus cuneatus. The second order neurons are crossing the midline, forming the internal decussation. So these are the internal arcade fibers which are causing the sensory decussation here. And after they cross, they form the medial lemniscus. They ascend as lemniscus. That's why it is called as dorsal column medial lemniscus pathway. So this is the sensory decussation, what you are observing. The internal arcade fibers. These are the second order neurons from the nucleus gracilis and nucleus cuneatus which are decussating. And then after decussation, they are forming the medial lemniscus. And you can also see the lower part of the inferior olivar nucleus. You can see the reticular formation. You can see the spinothalamic tract and the spinocerebellar tracts. So this composes the gray matter and white matter. You can also see the pyramids. Now here, what are the gray matter? Yes, nucleus gracilis you have seen. Nucleus cuneatus also you have seen. Accessory cuneate nucleus also you have seen. So nucleus of spinal tract of trigeminal nerve also you have seen. So these are present on the dorsal aspect, and in the central gray matter you have seen the hypoglossal, dorsal nucleus of vagus and nucleus tractus solitarius. See, hypoglossal, dorsal nucleus of vagus and nucleus tractus solitarius. So in the white matter, internal arcade fibers. So this is the decussation. So these are the internal arcade fibers, nothing but the second order neurons coming from the nucleus gracilis and nucleus cuneatus. They are decussating. This is the sensory decussation, and after crossing, they are going up as medial lemniscus. And in medial longitudinal bundle. So here you can see this is the medial longitudinal bundle. Then nucleus of spinal tract of trigeminal nerve separated from central gray matter. So here you can see this is the nucleus of spinal tract of trigeminal nerve, and you can see the spinal tract of the trigeminal nerve covering the nucleus. So posterior and anterospinocerebellar tracts, lateral spinothalamic tract, and reticular formation. So all these are the components of the white matter at the level of sensory decussation. The most important thing is the internal arcade fibers. So this is a key feature at sensory decussation. So next, spinal lemniscus formed by closely present anterior and lateral spinothalamic tract. So it is not prominent here, but once we go into the pons, we'll see clearly the spinal lemniscus. Now, coming to the transverse section of medulla at the level of olives. So now, if you observe here, what is the key change here? In earlier, if you see, there is central canal which is closed. The dorsum is not open. Now, if you observe, the cavity has opened up, forming the floor of the fourth ventricle. So that's why the central gray matter has almost reached the dorsal aspect, reaching the floor of the fourth ventricle. So you can see this is the hypoglossal nucleus. This particular area will be the hypoglossal triangle, which I have shown in the dorsal view earlier. So now you can observe this is the hypoglossal nucleus. Again, the same story, that is the gray matter, white matter, and the other components. Like if you see, this is the gray matter. The gray matter is having the hypoglossal nucleus. Then you can see the dorsal nucleus of vagus. You can see the nucleus of tractus solitarius. You can see the vestibular nuclei, the spinal nucleus of trigeminal nerve, and you can see the nucleus ambiguous. And you can also see the inferior olivary nucleus with dorsal and medial accessory olivary nuclei. So all these components are the gray matter. So let us revise again. The hypoglossal nucleus, the dorsal nucleus of vagus, nucleus of tractus solitarius, vestibular nuclei, spinal nucleus of trigeminal nerve, nucleus ambiguous, dorsal and medial accessory olivar nuclei, then inferior olivary nucleus, and you can also see the arcade nuclei, which will give rise to anterior internal arcade fibers and anterior external arcade fibers. So now if you see the white matter, as you observe here, you can observe this is the inferior cerebellar peduncle, and here you can see these are the spinocerebellar tracts, and you can see the lateral spinothalamic tract. You can see the medial lemniscus. You can see the tectospinal tract, and you can see the medial longitudinal bundle. Then, if you come down further, so let us see whether we have observed all these structures in the diagram or not. Hypoglossal nucleus, yes, you have seen the hypoglossal nucleus. Then nucleus intercalatus, then dorsal nucleus of vagus. So here is the dorsal nucleus of vagus. So in between them, there will be nucleus intercalatus. So then vestibular nuclei, yes, this is the vestibular nuclei, and nucleus of tractus solitarius. You can see here, this is the nucleus of tractus solitarius, and you can see the nucleus ambiguous and arcade nuclei. So here you can see this is the nucleus ambiguous, and these are the arcade nuclei in front of the pyramids. So then inferior olivary nucleus, dorsal and medial accessory olivary nuclei. So you can see the inferior olivary nucleus, the medial and dorsal accessory olivary nuclei. So then you can see the medial longitudinal bundle, tectospinal tract, medial lemniscus and pyramidal tract in that order. You can see here the medial longitudinal bundle, tectospinal tract, medial lemniscus and pyramidal tract. All these four tracts, and here you can see the side dorsal and ventral spinocerebellar tracts and lateral spinothalamic tract. So now coming to the blood supply, mainly this entire medulla is supplied by the two vertebral arteries, anterior and posterior spinal arteries. So these are the branches of the vertebral arteries. So anterior and posterior inferior cerebellar arteries, again these are the branches of the vertebral artery, and then the basilar artery. So if you observe here, two important clinical syndromes are there. So if we see this medial part, when it is affected, it is called as medial medullary syndrome. So this is area involved in medial medullary syndrome. And here if you observe, it is the area involved in posterior inferior cerebellar artery syndrome. This is the lateral medullary syndrome. Lateral medullary syndrome. So now if you really observe this particular areas, see here, there is involvement of the hypoglossal nerve. Okay. There is involvement of the medial longitudinal bundle, tectospinal tract, medial lemniscus, and pyramidal tract and arcade nuclei. And here, if you observe, there is involvement of the dorsal nucleus of vagus, nucleus tractus solitarius, vestibular nuclei, spinal tract nucleus, nucleus ambiguous, then spinal tract, then inferior cerebellar peduncle. So we are going to see the features which are the functions of this particular structures which are involved. So clinical features will be same as the functions which are affected here. So if you observe here in the medial medullary syndrome, otherwise called as degenerative anterobulbar syndrome, there is a paramedian region of medulla which is involved, which is supplied by vertebral artery. So contralateral hemiplegia. So hemiplegia on the opposite side, contralateral hemiplegia means. So why? Because you can see here, the pyramidal tract is involved. So that's why there will be hemiplegia on the opposite side. So next, ipsilateral paralysis of tongue, because the hypoglossal nerve is affected and this hypoglossal nerve is not crossing, so same side tongue will be affected. Then contralateral loss of position and vibration sense. Why this position and vibration sense? If you observe medial lemniscus, what is the function of the fasciculus restless and fasciculus cuneatus? It is the joint position and vibration sense. Okay, so all these are lost due to damage to the medial lemniscus. So these are the symptoms of medial medullary syndrome. Now, if you come to the lateral medullary syndrome, otherwise called Wallenberg syndrome. So it is the dorsolateral part of the medulla which is involved. Here you can see this is the dorsolateral part of the medulla which is involved. So mainly this area is supplied by posterior inferior cerebellar artery. There will be contralateral loss of pain and temperature in the trunk and limbs. Why? Because you can see the spinothalamic tract is involved. That's why there is loss of pain and temperature in the trunk and limbs. Then ipsilateral loss of pain and temperature over the face. Why? Because the spinal tract and nucleus are involved. So these two are resulting in these features. Then ipsilateral paralysis of muscles of the palate, pharynx and larynx, because you can observe here this particular the dorsal nucleus of vagus is affected. So which is supplying this, and along with that nucleus ambiguous is also affected. So these are supplying this particular area. And then ipsilateral ataxia, because you can see the cerebellar peduncle is involved, and you can observe giddiness and Horner syndrome. Giddiness and Horner syndrome, because sympathetic trunk is affected. That's why Horner syndrome. Giddiness due to vestibular nuclei involvement. So like this, the area, the presence of gray matter and white matter, and if you know the function of this gray matter and white matter, once this area is affected, we can easily find out the symptoms. So that's why when we examine on clinically, so if you observe there is ipsilateral paralysis of tongue, we can see that there is hypoglossal nerve which is affected. So we can try to correlate it with the lower part of the brainstem, that is the medulla, where hypoglossal nucleus will be present. Thank you.